Okay. All right. So thanks to those of you guys who have signed on and wanted to join in for today's sort of like talk. It's not really a talk. I mean, it's really just a Q&A. I just thought that there's so many of us who are practitioners who are just bombarded with cases in our clinics that stem from traumas and whether we know it or not, initially, or whether they know it or not, it's not an uncommon scenario for me in my practice to treat patients from, whatever walk of life and whatever signs and symptoms they come in for, whether it be, cancer treatment, autoimmune diseases, chronic migraines, I mean, you name it. So often I'm tracing the roots back to trauma. And I imagine many of you guys are seeing similar things. So I just thought it might be fun to utilize Zoom in a way where we can sort of get together and talk about some of this stuff and flush it out. I mean, I teach workshops all the time on these topics, but usually that's just me sort of downloading and disseminating just tons of information. But more so, I was curious about what people's experiences were, and how everyone is sort of managing this burgeoning population of patients. Because I think I don't think it's a new thing necessarily. I just think people tend to be a little more aware these days of the underlying roots of traumas for patients. And so anyway, I thought it'd be fun to sort of get together and talk a little bit about it and get a sense of what people are doing and share what I do and how I think about things, and just sort of go from there. So I don't know if anyone wants to jump in or ask a question or share some experiences, or if I just give you a quick example. A patient came in today. He's a long-term patient of mine, but he brought in his son who just has been having issues with night terrors and sleepwalking, and so this is like a no-brainer for me. When I hear that in a child, the first thing I think is that there's some type of trauma that has happened, but sometimes the traumas are not always so, I don't know, overt necessarily. And I find this to be really interesting because my experience is that trauma that happens early in life predisposes one and makes one more vulnerable to more traumas. And those traumas don't need to be severe to sort of rise to the level of what I would call heart shock, because the nervous system is more permeable, right? The boundaries are just not as uptight or upright, I should say, as we would otherwise want them to be. And so things that for maybe a person with an intact nervous system, maybe they would sort of let's slide off their back. Someone with a foundation of early life trauma is not able to do that. And so we start to see these traumas sort of layering into and hardwiring themselves into the person's physiology and psychology, right, and mental states. And so for this particular child, they had some early life issues in terms of mother not dilating, and then doing there wound up being like an emergency sort of C-section, and then there was issues where the mom had to go back to work when the baby was only 6 months, and so the baby was sort of shuttled off into like a daycare, which was traumatic for the baby. And then a few years later, the main caregiver, the grandfather who was there, died. And so all these things that not any one of which seemed to be, to the parents anyway, to be so incredibly substantial in terms of like seeing changes necessarily in the child's temperament. But after a few of these things happened, then they started to see very soon, about maybe like a few months after the grandfather died, that these symptoms, sort of took hold, and we started to see the night terrors and sleepwalking and so forth. And so we sort of just walked that back, traced it back, and of course, the pulse had the pathognomonic findings of trauma. The tongue showed these types of issues too. He had issues under the eyelid in the mucosal lining, showing that there was a lot of sort of nervous system tension, creating a lot of heat internally. So all these factors, we kind of just piece them together, and we can again weave the story, because that's really what we need to do. We need to weave the story together to get a sense of what's going on. But and then from there, of course, we herbal formula, Daoist talisman, and we'll revisit in a couple of weeks and see how they're doing. But anyway, does that resonate with people? Are you guys seeing that in your practices? Well, I can't hear you, Zoe.
Yeah, there's lots of trauma that has embedded itself in people. That's true. I'm always looking for what, like you said, you weave together the story. I'm always looking for what's sort of basic balance there, and go from there.
Yeah, yeah. Do you find, like, in your, because you're more of like Japanese style, is that right? You,
Yeah.
you do like Toyohari and that kind of stuff?
Yeah.
So do you find like sort of pathognomonic issues of trauma? Like you see like, oh, a particular finding on the abdomen or the pulse that you say, oh yeah, that's, I know this person, whether they talk to me about it or not.
Um, that's a hard question for me to answer. There's not a specific thing, but it's more a sense of what is throwing them off and whether it fits or not.
Right.
Okay.
Okay.
Whether it makes sense. Some of that trauma, it seems to shift them so that their cognition is not straightforward.
Mm.
There's something that doesn't fit together exactly right. But I have to think about it more. I don't have specific things that I look at.
Yeah. I was curious because I know, palpation, of course, is really big for you guys, right? So I was just wondering if, because I don't do a lot of like a lot of channel palpation and things like that, but I was wondering if maybe for people who do that, if there would potentially be sort of characteristic signs in sort of like tissue densities, or the way that someone responds to touch, or things like that.
Well, that's a good question to think about. Certainly, being ticklish is,
Yes, I
yeah,
talk about that in my classes.
yeah.
Yeah,
It's like a defensive reaction, and some
for
people
sure.
are very much. It's very severe, the amount of ticklishness that they have, and that is a good sign
Yeah, yeah,
that they're
agree.
very defensive. But I don't know. I'll have to put that in my
Yeah, I'd be so curious
awareness
to hear.
to
Yeah.
see because I don't know. I don't have an answer to that.
Yeah. Yeah. No, I just wondering if anyone did that. So I know, like, I talk about ticklishness in the class. I mean, that's a common thing we see when we're palpating the abdomen, or especially like on the ribs, on the side and the floating ribs. People get really, like if you're doing a dynamite treatment or something, people really jump and can't handle that tension there. But also, putting your hand on someone's chest, that's been like this sort of sign of like gwei, right? Like there's a, like the ghosts really don't, and in the goo, they don't like that. It's like very oppressive, so those are certain things that we see. And then just the overall tension and hypervigilance that tends to show up in people's musculature, right? And it's just uncomfortable for them.
Yeah.
Yeah.
I guess a lot of my signs are more how they're presenting themselves, not just their story, but do things fit together? Do they make sense? Or am I seeing
Mm.
some I don't know, just things that they're putting together that are not that don't fit together. I'm having
That's
trouble.
it. That's really interesting. So you mean less so in terms of like that there's contradictions in signs and symptoms, or more that the way they storyline and narrate what happens, that they sort of like
It,
um
yeah.
yeah.
And also the other thing, another thing that I do pick up is that some people are have so many symptoms. They're hyper vigilant.
Mhm.
They're picking up symptoms all over the place, and they're little things like this finger hurts when I garden, or this, I mean, it's like little tiny things that they're really, really upset about, and lots of them.
Mhm.
And that is a heart sign to me.
Yeah.
That that's very frequent, that they need to be calmed down to see that they're not as bad as they
Mm.
uh, tend to be thinking about them. But I have a number of patients that are like that. And to me, that's a sign of real heart issues.
Yeah, it's clearly like the sensitivity
Yeah,
to the experience of what and it sort of gets um I don't know, it's larger than it would otherwise seem to be, right? It's
right.
hyperbolic in certain ways.
And what I see is, as I treat them based on a heart pattern, as I treat them, they stop doing that as much.
Mm.
And there's less symptoms, and there's less hypervigilance with the symptoms.
Yeah, that's super interesting. Yeah,
Yeah,
I would say I see that too, for sure. It's definitely, those heart patients are the ones who um, tend to be more upset about particular things, and there's a sensitivity that is beyond the level of that which they seem to be complaining of.
right.
Yeah, yeah.
And there's just multitudinous symptoms.
Yes, yeah. Even when there's not a lot, they'll find them.
Yeah, all over the place. And it's as soon as that happens, I know I'm dealing with the heart.
Hmm.
As soon as that they present like that, I know I'm dealing with the heart. And that if the heart heals, that doesn't happen. They start to not be paying as much attention to it.
Mm. Yeah.
Quite.
Wow. Yeah, cool. That's awesome. What do you guys notice? The other ones here, Elizabeth, and I know you're not necessarily doing acupuncture, but
Um, yeah, I guess I was curious. I'm not an acupuncturist, but I'm curious what you would call that in terms of the diagnosis of that, like that would, I'm just curious what you think that might be for the heart.
well, I don't think it's just one thing. I think there's many different patterns that can show up that way in terms of how, in the more specific ways that they respond. I mean, you can look at that as, heart and kidney not communicating from like a very sort of TCM perspective, you
Oh,
know. But sometimes these people, they can get really agitated also, and have more sort of wood characteristics to them. Some of them feel that, and their worry turns towards like a doom and gloom, sort of perspective, right? Where they think they're dying, or that, fear takes over, or, you can see all the different elements at play in the particular individuals and how each one sort of presents. So I don't think it's just one thing, but I think it's sort of the heart interplaying with the other dynamics depending on constitution and a whole bunch of other sort of factors that are there.
thank you.
Yeah,
Interesting.
yeah. Do you see that too, Rachel?
Sorry, my son just came into the room.
Oh,
I have to be a little transparent. I was not expecting this to be a Q&A. I was sort of thinking I was going to kick back and listen to you talk. This is great. So more transparency. Well, I'm really excited to study with you, because it's been a while since I've really immersed in a kind of lens. The last big lens I immersed in was with Lonnie Jarrett, and I feel like it's still my lens. Like I'm very often talking about the heart as the emperor, and the fire officials as a protective mechanisms and relationships like that. I talk about it a lot.
Yeah.
And so that's my lens. And you know, again, my pulse diagnosis has gotten, again, to more transparency, kind of unreliable. So I'm
Mm.
looking forward to kind of learning more, getting more clarity on
Yeah.
what
Yeah.
I can find. But I mean, clearly there's irregular pulses a lot of the time. So to speak, I don't know if I'm responding to this particular question
Oh, that's
directly,
okay.
except
Yeah.
to say
Whatever you
that,
want to bring up and talk about.
yeah. Well, yeah, I feel like at this part of my practice, especially with the training and imparting clouds and learning there, there's a lot that happens non-verbally in my practice now, interestingly.
Yeah.
That gets transmitted through what's just in the room. So again, I don't have much to say specifically other than having an interest, or I'm very drawn to how the practices in, and I don't really even know how to address it in this forum. I'll just say the Parting Clouds education, how that education interfaces with your work with Leon Hammer. That's really intriguing to me.
Yeah. So that's something that we're going to do a little bit on that on the third day. Because I want to sort of present this whole, you know, narrative and storytelling. How do we create it, right? Because I think for me, this has like sort of evolved as one of, if not the most important thing that I do, I think, with my patients, because I think, you know, it's all well and good, I think, for all of us who've been practicing a long time and who feel confident about making certain diagnoses to sort of present it as if, well, I'm the doctor and you're the patient. This is what I found, and this is what it means, and this is what you got to do. And if you don't do this, is, you know, you're not going to go down the right trajectory, and yada yada yada. And I think I don't I haven't found that to be effective in my practice. And I think I started off that way at some point, because I, you know, feel like, oh, I'm learning the stuff, and I feel this and I know what it means. And and that's of course still stuff we do, but I think the resonance of the relationship and how I've learned that from Leon has sort of risen to, you know, really the place that where the change happens, I think. And because I've had lots of patients over the years, like, you know, 20 years ago, 15 years ago, when I was a younger practitioner, and I would come out and I would say, this is what it is, this is what I found, this is the why, and this is what to do. And then, you know, all great. And then I'm like, oh, I'm really excited to dive into this treatment plan. And then the patient doesn't come back anymore, you know, or it was too direct, or it was, you know, too overwhelming, too much information, or it was just whatever it is. And, you know, so I think for me, it's been an evolution of figuring out how to talk to patients really, and how to relate to them, and how to bring the depth of this information in a way that isn't scary, because it can be really scary, you know, like when you start talking about like someone's nervous system and their heart, and they think all these things are going to happen, and, you know, should I go to a cardiologist, and, you know, how about should I go see an electrophysiologist? I get these questions, you know, all the time. And, you know, how do we navigate these things? And I think tying it back always to the patient's lived experience is the key, right? And so there's ways of, I think, doing that. You know, we don't have, you know, I'm not a talk therapist, I'm not trained in talk therapy, I don't spend my days doing that, and I wouldn't, because that's, again, it's not my area. So we don't have an hour to like delve into this stuff with patients, you know, every week. But what we do have is that initial visit where I do spend an hour and I do take their pulse for, you know, 20 to 30 minutes, depending on the complexity. And I've already spoken to them, and I have a history, and I understand the dynamics. And then the way that we sort of like unwind the pulse very specifically to their lived experience and understanding and explaining why they're going through what they're going through, not telling them, that really anything that they don't know, except explaining it in a language that is able to sort of bridge worlds together that allow for an energetic understanding of something out of the, sometimes we talk biomedicine, right? It's not like we don't ever talk about, I can use terms like nervous system and hormones, and I can explain why the thyroid is the way it is, and these sorts of things. But I think the beauty of it is explaining it in a heart-to-heart sort of resonant way. And I think the pulse is like this amazing bridge for this, right? Now, number one, like any like a paradigm that we have, and especially I think, when we're looking at things from a lens of heart shock, which isn't really even just one lens, right? Because we can look at heart shock from a 5-element perspective, we can look at it from a sinew meridian perspective, or a divergent meridian perspective, or a low vessel, or an 8 extra, and so we can walk that specificity if we need to. But the pulse is sort of this amazing bridge, because it's like I've got this pulse record that I'm filling out the whole time, right, for like 20 to 30 minutes, noting all this stuff, and then I show it and I said, this is what this means. And I'll even draw qualities for people. I'll draw the depths, and I'll show them this is the waveform that should be normal, and this is what's happening here, and this is where your pulse should be at each depth, and this is what's happening for you, and this is what it means, and this is how it relates to this experience of, say hot, say it's an empty pulse, and this is why you're getting your hot flashes, and this is, and we sort of like weave it into this like narrative for them. It becomes really important. And then, like, to bring this in back to the land of like parting clouds and Taoism, when we look at this and we say, well, the pulse record now is not just an objective sort of like document, it's sort of like a resonant document, and it's actually a talisman is what it is, right? Because it's, and so when we write talismans, we're writing something that is mirrored in the celestial bureaucracy, right, somewhere, right? And if it's mirrored exactly, right, then it's, and we're authenticated for doing it, and then we put our or our incantation into it, it brings it out into life. So the pulse record becomes the talisman. It's mirrored from specifically what I just felt emanating from their person. And then I narrate it back to them as the incantation, which brings it now to another place where it's like it's been authenticated, because they can, your hearts are touching, they understand the pulse, they understand the history, how it ties into the signs and symptoms, how that ties into all the things they've been experiencing, over the course of time, right? And we've now created a whole framework for them to allow them to start to see things from a perspective that is different, right? Perception is the key, right? So we'll be opening the portals in that way, which is what we're doing when we're trying to bring this back to someone in this way. And then we've now just begun the process of untying all the knots and the obstructions and the things that are preventing the healing process from taking place, right? This becomes the catalyst. And so that's been my, my approach, that I've sort of to weave all of these sort of elements together. Does that make sense?
Yeah, that's fascinating. So to kind of repeat back for my own clarity, it sounds like that depth of reflection gives a quality of inner understanding of oneself, kind of objectively, interestingly, but also subjectively. And yeah, it's like an illumination.
Yeah.
I'm sorry. Oh, yeah, it feels like to the client, to the patient, right? And so it sounds like in that regard, you're right, setting conditions for greater awareness. And then I guess assumably you're from there, you're, how we follow up with that kind of reflection would be obviously herbs, acupuncture, diet, exercise, whatever, like lifestyle changes to sort of assumably shift the record, right? Like if the record is such on day one, you see someone, the interest would be to change the record.
Right. Absolutely. Yeah. And that's what we do. And so when I take someone's pulse on the pulse record, right, I always write in blue ink. And the next time I see them, I write in red ink. And then after that, green ink. And then after that, black ink. And I can do 4. So I overlay 4 pulse records on one. And that, spans the course of, many months of treatments. But it's a great visual because people can sort of, get a sense of what's going on, and they see the changes. And there's nothing, and I started doing this, funny enough, because one of my patients, I've been seeing him for like 20 years, and he's like in his mid to late 90s now. And he was the one who asked me to you gotta give people something to look at. You gotta give them something to look at. People they're like me, they want to see change, so I don't have I can, send someone out for like diagnostic tests or whatever, but like for what I do, they want to see it on paper. So I show them on paper. And then each time, it's very cathartic to see like a quality being like crossed out, in a different color. And it's like, okay, not there anymore. It's that's resolved. And, it's a great thing. And, the thing about the pulse record too, is that, they do get a chance to see things differently, but they also get a chance to understand, because I do want to make this clear, because, and this is something that Leon has talked a lot about, because the pulse system is so sophisticated, and we can spend all this time, and there's 28 different pulse positions and 9 different depths, and it's like 90 different qualities now that and different sensations that we can perceive. It's so easy in many respects when you do this for a period of time to pick out everything that is like not normal, right? And I don't even know if I've ever felt a normal pulse, really, but what we don't want to do is just report the problems, right? Because people need to understand the strength, right? So it's like if you were going to give someone, a talisman, you're giving someone like thunder, right? You're giving them yang, you're giving them thunder, you're giving them something where they can have a stronger constitution, feel more stable, feel more courage, feel more enlivened and animated, right? So we have to let people understand their strengths too. And I think, interestingly enough, sometimes it's way more therapeutic to let someone understand their strength than it is to just pinpoint why they're sick, right? Because I think, especially for people coming in for heart shock, and especially people coming in with chronic illnesses, they can feel inferior, they can feel weak, they can feel down and depressed and despairing. And to let someone know, like, wow, like you've been dealing with this for decades. And the reason why you're dealing with this for decades is because you are that strong, because you do have the capacity to like handle this onslaught of like toxicity and the damage that's been done from all of these things, right? I mean, it's really it's a cool thing to see someone's face sort of like realize like, wow, it's like I'm suffering almost because of the integrity that I have in my physiology, because I'm strong enough to withstand where maybe other people wouldn't even have been able to like make it through this far, and that was really one of the main, the main impetus of the book. And I talk a lot in Heart Shock about hexagram 51, the thunder hexagram, because I think this is so important, to understand thunder, right, and shock and trauma, as it's like there's 2 sides to it. One is the damage that's done, and the other is the rectification that's done, right? So we're harnessing it for rectification, and so it's interesting. So I was listening to a podcast the other day, and the person, just made a really very, I think, great comment about people who are sort of forced into a state of growth and evolution. And what he said was, and this is common, we see this in Buddhism and Taoism and a lot of spiritual traditions, is, you don't wake up from great dreams, right? You wake up from the nightmares, right? Those are the ones that like spur us to grow and evolve and move on and move forward, right? And I really strongly believe that trauma is one of those mechanisms, right? It's something that wakes us up. And of course, we have a couple of possibilities. When it happens to us, we can go in and get stuck in it, or we can move through it, right? And so my job, is to help people move through it. And I do think that when they move through it, they're not at a pre-trauma state. They're at a state above that because they've gotten through something really, really difficult. And that's an evolutionary process. It makes you stronger. It makes you understand you have more adaptive tools in your tool belt, right? And it makes you more resilient over time, And I think this is something that I think I thought about this when I was writing the book, and I think I mentioned it in the text, but years ago, and I was talking, and I think it's actually even written in Dragon Rises, Redbird Flies, and in Dr. Hammer's one of his first books. But he talked about, and at this point, it was early on, and he was sort of just like really thinking out loud, I think, in his book about this like notion of all the C-sections that are generally done. And he's not talking about emergency C-sections, because that's from trauma and things like that have to happen. But there's so many elective C-sections, right? I mean, it's like almost like birthing has become so medicalized. Now we do it at the convenience of our doctor rather than anything else, right? So he talks about moving through the birth canal as being one of the first struggles that we have coming into the world. The pressure that's exerted on us, the breathing and how that changes, what that does to the lungs and the heart and the circulatory system and the nervous system. And then we sort of like come out, right? And we've made our way through this first sort of real challenge in life, and what that does for creating resiliency and creating integrity in the nervous system, right? So little things like that. I shouldn't say not little. It's pretty huge, right? But we don't. I think in our in biomedical world, we don't really think about that much. Doctors don't think about what the challenge. I mean, not to mention the seeding of the microbiome and all those kinds of things, right? But the idea of like struggle and challenge and overcoming it, and how that really strengthens, it's like a muscle, right? It's like it strengthens the nervous system like a muscle. The more we use it, the more we learn that we can sort of put ourselves through certain stresses and be okay, right? We know life is suffering, right? That's no surprise, I'm sure, to anyone here or anyone that's going to watch this recording. So if life is suffering and we don't have the capacity to suffer, we're in real trouble, right? That's where illness, really significant illness, can come into play. Do you have any thoughts on that? I mean, Elizabeth, I know I cite this in my book. Peter Levine talks about that a little bit. He talks about like the when Medusa is killed, right? And the 2 vials of blood, he mentions that in his book in an unspoken voice, right? Like he took 2 drops. One had the power to kill and the other had the power to cure, right? Like he mentions that in sort of like these old sort of lore, and he goes through, talks about Zeus. He talks about other, the animals on safari. He talks about, so many, Lot when she's frozen, right? These different types of stories that we hear. And I don't think that they're just like these fanciful stories. These are important messages and lessons that I think are, for the most part, sort of lost in a very sort of, reductionist world.
I think, if it's okay if I bring in Peter Levine a little bit.
Yeah, of course.
Okay, because I don't want to be on.
No.
But so the reactions I have from that work, which I am trained in, is actually what you're talking about is basically the core of somatic experiencing. Because when you're actually doing or receiving somatic experiencing, the single, at least in my opinion, right, the single most important practice is what they call titration, where you actually have the person feel the shock and then feel, maybe it's just their toe. Where do you feel okay? And you go back and forward. So to me, that's very similar to what you're talking about, resilience.
Mhm.
You know, let's say what Zoe was talking about. Oh, my finger hurts. Okay, can you feel a tiny bit of that? And then what about your toe? Oh, that feels okay. That really, I can speak personally, has helped me.
Mhm.
And I've seen it help with others. So I think this question of what is resiliency is, and how do we encourage it, is very profound. And it does require what you were talking about, which is resonance, not just telling someone something.
Yep.
Listening. That's a different way. Resonance. And actually, there's one other thing I can't resist mentioning. They did a study, and I don't have the citation to it, but they did a study on different types of therapy. And, you know, cognitive, all kind of different kinds. And the thing they found was the most important was not the kind of therapy. It was the degree to which there was resonance between the therapist and the patient.
Mhm.
That's amazing, isn't it? I mean,
It is amazing.
it just puts everything, so many of our little thoughts, you know, in another category. You might call it what Zoe was talking about, duh, you know, like if the person's really with you and you feel that, that's doesn't really matter that much what they say, I think. Well, I'm exaggerating, but so that's where I'm getting like a little resonance with what you're talking about and what the other Zoe and Rachel are talking about. That's what resonates for me. This very
Yeah.
basic human feeling.
Absolutely. Yeah, I mean, I think that is so important. I remember, you know, and to some degree, it's like this idea of entrainment, right? Where it's like as the practitioner or as the therapist, you're sort of creating the waveform that you want entrained, right? So it's like and I always think about it in terms of like, so I'll give you a story. This is one of, not my story, but it's that Dr. Hammer has told, and I'll just simplify it and abbreviate it. But, and he's done this so many times in his career with different patients, but he used to like identify, there were certain capacities. So say someone had, you know, a big pot smoker for years and years, and they like destroyed their liver, right? Their liver yang now is completely wiped out. They've lost the ability to sort of like some of these executive functioning abilities aren't there. The ability to really like organize and see things through and be motivated and goal oriented and so forth, right? They couldn't even, like, to the point of like, you know, they're getting fired from every job because they won't set their alarm and get up in the morning, right? And so what Dr. Hammer would do for some of these patients was he would be their alarm clock. He'd get up in the morning, 7 o'clock in the morning, he's, you know, dialing this patient saying, okay, get up, time to get up. You got to get to your work today, you know? And so he was sort of like creating this in someone who sort of lost the ability to do it. And right, this idea of resonance, this idea of entrainment. I mean, you know, I always think, I wonder if I could, let me see if I can share like a whiteboard or something. I don't know if I can, let's see if I can do this. Yeah. So can you guys see this board? Yeah. So I always, you know, I kind of think about it like really in very simple sort of terms. Like if you have like this person and they're sort of like moving on this basic frequency, right? This is sort of like their norm, right? This is like the free and easy wanderer, right? The liver chi that is flowing freely. And of course, that's different for everybody, right? There's not like there's one ideal, but it's like for you. And then we have different types of stresses, like say a shock or a trauma comes in, and so what that does is it brings something different into the system, right? And so the question is, what's going to entrain what, right? Is there enough integrity in this person's nervous system, right? Like this, so in our terms, like in parting clouds and Taoism, we call that the Zheng and the Xie, right? The upright and the deviant or the wobbly, right? And so at what point can our body take this xie and turn it back into and align with the zheng, right? With our normal sort of rhythms. That's homeostasis, right? That's the ability to allow for things to move back into place. And so it's not uncommon, and I should think it is almost definitive because it's a pathognomonic finding on the pulse of what trauma is a rough vibration. So on people's pulses, we see this, right? That's what we see. We feel this rough, buzzing, coarse sensation. When we feel it on someone's pulse, we know that they've experienced trauma, right? They have not been able to move back to this sort of normal, smooth flowing frequency of the zheng or health or homeostasis, right? And so that is, to me, one of these like huge factors that we can sort of initiate for patients to some degree with our own resonance. We use our own sort of ability to do that, right, for ourselves, which is why it's so important that we try and take care of. I know we all try and take care of ourselves. It doesn't mean we have to be perfectly healthy to do this for patients. I don't know anyone that's perfectly healthy. We're all sort of like a dynamic work in progress. But this is the nature of it, right? We're trying to create that dynamic for people. So where they're in the beginning, we help them do it. We give them the tools to do it on their own eventually so that they then can do it themselves. Yeah.
I have another question, which is a little different, which is, how do you use talismans in this process? I'm very curious about that.
Yeah, that's a big question. So that's there's lots of ways to do that in the lineages that I practice in. But we have talismans that are designed to before I mentioned the idea of thunder, right? So we have talismans that use the energetics of thunder to create that rectification, right? So it would be something that would be strengthening yang in someone, but also like really dramatically purging turbidity out of the system, right? And so in very simplistic terms, that can look like opening up obstructions in the circulatory system, right? Chi, blood, fluids, all of that. It could be something that opens the portals, right? So it's like phlegm misting the orifices, right? So I'm not seeing clearly at my self-talk and my narrative that's going on all the times is distorted. And I perceive the way people react to me in weird ways that aren't really intended all the times. These are all distortions, right? So this is all like, we call that yin or turbidity, things that are blocking the clarity of our portals and our perceptive capacities. So the talismans can sort of like bust those open. There's talismans that are meant to calm the spirit and create a more stable structure, right? Getting rid of things like anxiety and panic disorders, like running piglet chi, like those kinds of things. There's, all sorts of things like that within the lineage that I practice, and the variety of talismans that can be used. So there's hundreds of thousands of talismans out there, but these are some of the ones that I use a lot for my patients.
Do you give them the talisman, or?
So there's a number of ways of doing it. So sometimes they're written with calligraphy brushes and particular ingredients that make up ink and things like that, and then it's done on certain sizes and colors of paper. And so sometimes they're worn in a pouch or just on the person's body. They can be like folded. They're folded in particular ways. Sometimes they are burned, and the ashes are placed into a bowl, and then we add sometimes either just water or rice wine or different types of herbs to mix with it. Then they would then consume it internally. Sometimes they're written on people energetically with either like, with fingers and light, or sometimes you use things like incense sticks. So there's lots of ways of doing that, but it can be very energetic sort of process. Oh, you got one there. There you go.
Oh,
nice. Yeah, they can be imbued.
Jade, yeah.
They can be imbued into jade and things. So I have one that I wear every day as well, that I do talismans on this, as well as in there. You can do them in water and other liquids and then drink them. So there's lots and lots of ways of doing that, but it's a very energetic process. And so you could also use your own energy and thunder and we call it the golden light of the Jingwang, and actually move it into someone and through them to clear energy. So there's lots of ways, but it's very powerful. I mean, I find it to be, if it were up to me, I would do that and not do acupuncture. Honestly, I find it way stronger, energetically than, and people respond very quickly generally.
Wow, thank you.
Yeah. Anyone else have any like questions or comments or things that it sort of brings up? Yeah.
This might be more than we have time for, but the question around trauma being from previous incarnations and sort of the inherited karma into this life. Yeah, just a big, broad-based question about that. Yeah.
I mean, I think, without getting too philosophical about that, I think it's from many respects it's treated the same way. I mean, I think you can go and spend a lot of time looking and trying to decipher the root of something like that. I don't know that you'll ever know. Years and years ago, I had a Buddhist teacher who I asked these kinds of questions to, and things about karma and how do I know where this came from or what's gonna, and basically said, don't even think about it. He was like, it's kind of, I mean, not that it's a waste of time, but it's a philosophical, mental pursuit that can take away from being in the moment and healing what is in front of you, And I think so. For example, like in a less dramatic way of what you're talking about, it's not uncommon for certain populations of people to have pulse qualities imbued within them, hardwired into their nervous systems constitutionally, because their parents or their grandparents or whatever experienced particular things in their past, right? Very common, in the Jewish population to have, very tweaked, tense nervous systems, right? You see that, of course, also people who live in a big city. Everyone in New York basically has it too, right? So you can go and say, oh, well, it's from that, or you can just treat it, because it's there, right? And now, with that particular example, there's a couple of different types of nervous system tense conditions. Some are from lifestyle and some are constitutional. In that respect, it's good to know which is which, and sometimes you only find that out from treatment. But people who the pulse quality goes away, that's generally from lifestyle. Other people will still maintain a semblance of that pulse quality. Basically, it's just the way they're wired. And as long as they live a particular way, they are asymptomatic, right? But that predisposition may not go away. Does that make sense?
Yeah, that's really helpful. Thank you.
Yeah. So I think sometimes it's really hard to get too caught up in those things. However, I will say this, which brings me back to one of the things that we were talking about before, is if the patient believes it's from their grandparents and whatever, and then that's okay to indulge. That story's fine, right? Because one of the things that I truly believe, and something that I kind of been talking a lot about lately is, and it's partly, you see this in some of the descriptions of Juyo, right? In the Juyo medicine, is that the relationship between the priest or the practitioner and the patient is sort of like this, becomes like a ritual sort of space where the diagnoses become negotiated, right? Like in the beginning, I was like, oh, I'm the doctor and I diagnose this and this is what it means and that's what it's from. And that sometimes can be a hard pill to swallow for people. I mean, depending on the generation, like, I think like my parents' generation, whatever doctors said, they like, a doctor was God and whatever they said was fine. I think we've learned a lot since, that the fallibility of these things. And so this negotiated space, I think, to me, is where the magic really happens, you know. And this is what we're going to spend time talking about on day 3 of the course, because and how to negotiate that space. Because what does that really mean? It doesn't mean that anything goes. It doesn't mean that, like, whatever, you know, the patient comes in and says, oh, you know, I did something and that's exactly what started everything. And, you know, there's a direction that you take it, and you use that momentum to negotiate things, right? So you use the pulse, you use these different ways of moving, and we're sort of like driving this sort of like weaving little vehicle around until we sort of like get to that spot, narrow it down, and get right to the point, you know, which oftentimes in the Juyo scenario would be some type of, like, you know, moral, ethical failure, or some type of harbored emotion or guilt, or, you know, something of that nature, right? Like, that's where these things come from. And that's, you know, Juyo was used for those scenarios where it, you know, they talk about it in, you know, as the scenario where, as if it's so hard to diagnose, that the problem was as if it was created by a ghost, right? And that was taken to a couple of ways. One, you know, by the religious community, well, they are, and we're going to do some exorcisms. And then in the Chinese medicine community, it was more about, like, you know, things that are real, like these really subtle causes, like this patient who, you know, has this like shame and guilt from things, and they've been harboring it for so long that this has become like a parasite that has sort of like created, you know, illness over time that has been like embedded and imbued into their cellular structure at this point. And so how do we get it out, right? You know, we see that a lot in Daoist medicine, right? How to sort of navigate that, right? Like, get back into the Celestial Masters movement. We see that with the confessions, and we see that in Juyo with this sort of process of navigating these things. And so that's sort of like the model that we use, but we direct it, you know, in our clinics now. Like, I mean, I don't necessarily go that deep with everybody in terms of hidden causes like that. We kind of just use the pulse and sort of show how to navigate into their own lived experience. And as we get closer and deeper, those things tend to emerge, you know, for people, right? Especially the more safety the relationship has and the less judgment that the relationship has, those things tend to come out, because people feel like, you know, it's they want it out. Like, these things want light, you know, especially when they start to feel like they're getting better. Sometimes these things become like they get blurted out, like they almost like they get built up to this point where, like, they're starting to move, and then it just has to like erupt into something. But I do want to answer Jen's question too. So she was off camera, but she wanted to know a little about the irregular pulse. So there's a few different kinds of issues with rhythm on the pulse, right? And, you know, what's important is that understanding that rhythm issues are, rate and rhythm both are the most important things on someone's pulse, which is kind of great because it takes no skill to really diagnose these things. All you got to do is just put your fingers there, and you can tell if it's a nice, smooth, even cadence and rhythm, and you can count it and get a sense of what that number is, right? But when we start to see abnormal rhythms, you know, we want to look at like a whole bunch of layers of classifications for these things, right? So we want to know if the rate changes only occurs at rest, or does it happen when they're moving? Can you measure the rate when, you know, sometimes people's rhythm issues are so chaotic that you can't even count it. Like it bends your mind to try and keep up with the cadence of the pulse, you know. So we want to see if there are missed beats, if those missed beats are happening often, are they consistent or inconsistent? Like, sometimes these, you know, what the question here is, sometimes you have what's called an interrupted pulse that is missing beats every, it's not regular. Sometimes it drops a beat every 10 seconds or every 10 beats. Sometimes it's like you can go 30 beats without a drop and so forth. And sometimes you get what's called an intermittent pulse that has a regularity to the dropped beat. So every 4 beats, every 5 beats, or every 10 beats, it's always there, and you can like set your watch by it, And so those tend to be often a little more of a significant problem. They tend to be a greater deficiency of the heart at that point. But the interrupted and intermittents are both significant, because they also mean that someone has experienced a trauma generally prior to the age of maturation, right? So usually for girls, that's before their first period, and for boys, before puberty. And so, and that's not always the case, because sometimes you can be later in life in a weakened state and have a very severe trauma, and you can get these rhythm issues. But typically when there's an abnormality here, the rule of thumb is that it happened before those ages, which is really helpful, because it allows you to sort of like guide the conversation and the questions to a place of certain time frame. And then you could also look at the rate at the same time and figure out because if you know what the normal rates are by ages, and you know that when someone experiences a trauma, it causes an elevation of heart rate, right? And if they're still experiencing, so if they have a rough vibration and they have a rhythm issue, we know there's been a trauma, right? And then if we look at the rate, and the rate is like, and say they're 40 years old and the rate is 40 beats per minute, it takes a long time for the rate to slow that much. So, right. So if the nature of trauma is to cause an elevated heart rate, over time, an elevated heart rate is going to be taxing the heart chi significantly. And that's going to cause a decrease and diminishment of rate over time. So if it gets to the point where now a normal heart rate for a 40-year-old should be around 72 beats per minute, and now it's 40 beats per minute, we can feel really confident that, especially with a drop beat, rough vibration, this trauma happened really early in life, right? And so then we can like pursue a line of questioning and uncover perhaps the cause of what that trauma was, and get a sense of its significance, and understand a whole host of things from there. This could be a scenario where, when I was 4, I was molested by my grandfather, and it was ongoing for a period of time. And, and then we start to unwind a lot of these things, create, this whole story that we can sort of piece together all the downstream impacts, right? The sequela of treatment over the course of the next 40 years of this person's life, right? So it provides just so much information. So, whether it be this interrupted or intermittent, it's less significant in terms of treatment per se, except that the intermittent pulse would generally require either a stronger treatment or a longer treatment. So I don't know if that is enough specificity, Jen, but there's no like one thing to do for that. But an intermittent pulse, which is this regularly irregular, right? That's something that's with heart chi, blood, and yang deficiency, generally in varying degrees based on the person. The irregularly irregular, right? That's the interrupted pulse, and that's a little less significant. So than the intermittent pulse. So you would just sort of tailor it and see how things change over time. And strategies would be based off of, depending whether this was really more of a heart chi issue, a heart blood issue, a heart yin issue, heart yang issue, right? Where's the deficiency? And of course, is there also, because we can see this too when there's blood stasis, right? So blood stagnation is going to also aggravate this scenario as well. And that, of course, when you have these types of issues and you have blood stasis, then you run the risk of other issues, right? And this is why, like in Western medicine, for example, they would probably put you on a blood thinner at this point, right? And say, oh, you got some AFib, and we're going to put you right on a blood thinner because we want to like prevent the risk of clots and so forth. Does that make sense? Oh. How do you integrate the notion of vagal tone having a healthy heart rate variability? Well, Sarah, do you want to come on and talk about that? Tell me what you
Yeah.
think about that.
Well, I mean, I always just, it was always just this thing that I had to translate back and forth in my mind, that in one system, there's a notion that you should have some variability in your heart rate, and that's an indication of vagal tone. And in the Shen Hammer system, there's really much more of an emphasis, it seems, on a more stable rhythm. So, is the heart rate variability just so subtle that it like flies under the radar of?
It's a little more subtle, and it's also more determined by things like stress, right, and signs of resiliency and nervous system integrity, right? So I think a lot about the vagus as sort of like it's like what's called like the wandering nerve, right? And so I think about that a lot of I think about free and easy wander. I think about the liver, right? I think about a lot of the liver's impact. When you look at heart shock, you see the liver as a significant responsibility in terms of mediating fire-water balance, right? It's sort of like that sort of bridges the gap in there. And I think that ability to maintain the proper tonicity that's really what so much of what the liver does in Chinese medicine, right? It's sending blood. When we're sitting down, all our extra blood pools to the liver, we get up and it goes out to the sinews and muscles and skeletal systems so that we can allow for movement. It goes up to the brain to allow for us to like be active, And so I think, and Dr. Hammer talks a lot about the liver as being like the place where that sort of like nervous system stress comes to, right? That's where it hits first, right? And it makes sense. The liver deals with our sort of armoring. It deals with our ability to sort of maintain that hypervigilance, which we talk about all the time from when someone's had trauma, So that's how I sort of look at those things. I don't see a conflict there. I see that as a mediator, right, in that way. And so that wood phase sort of creates that mediation between the water and the fire element there.
So what I just got from that in terms of an insight is that it's sort of like that picture that you drew for us. It's sort of like an absorption of the capacity to have a pillow
right,
for a shock.
Exactly. So for example, what's the best way, if you have something heavy on the ground, what's the best way to pick it up? What do you do first?
Bend your knees.
Well, yeah, but you generally like push weight down and then you lift it up, right? You create the opposite, right? So if I had that waveform that I showed on the screen, let me see if it's still there, right? If I wanted to transform this sort of rough quality back into this normal wave, first I have to sort of like follow the crooked a little bit. You got to follow it and you got to guide it, right? So that's sort of how I look at what that particular function is. It's the stress is coming in. I can't just like, it's like in Tai Chi, if you're very rigid and someone pushes you, you're going to go falling over, right? You have to be able to absorb it, move it, reflect it, and then alter it, right? And so I think that's the nature of what we're looking at from this dynamic system, And when it can't do that, and when the impetus and the catalyst is way too strong, you go into a dissociative state, right? You pass out, right? Or the hun flies away, and you have a state where you're in a trauma and you're just not there anymore. Your body's there, your mind is gone, and you can't remember, you can't recall it. Some people, see they're out of their body looking down, right? That's the same dynamic. That's that sort of like fold, right? The fight or flight and freeze and fold. That's what that is from, and that is a function of the liver doing that for us, right? And it's the hun that just flies away and escapes. To the problem is how quickly can we reinitiate that, right? How does the hun kind of come back appropriately, rather than being scattered all the time and not being anchored and grounded. And then we wind up seeing, these like empty left middle position pulses and, floating yang and nervous system tensions and all this stuff that just, people can't handle the stress because there's no anchor anymore, right? Because there's nothing anchoring it down. The blood has gone, the hun is left, and now we're just left trying to like, we're just startled all the time, and we're just like in a frazzled sort of hyper vigilant state, always feeling like there's a threat on us. Does that make sense?
I don't know if we have time, but I have one more question. Okay, that's about the lung and the breath.
Mhm.
In all the readings I'm doing in Chinese medicine, and of course, since I'm not a practitioner, could be I'm not understanding, quite possible. But it feels like I'm not seeing as much about the lung-heart connection, let's say heart-kidney.
Mm-hmm.
And yet, from a non-Chinese perspective, and partly a Reichian's perspective, which I know Dr. Hammer was into, the noticeable thing about trauma is that the lungs, the breath stops.
Mm-hmm.
Lungs can,
Yeah.
So I just wonder if you have any thoughts on that, where I could understand
Absolutely.
the
Yeah.
lung issue.
It's a great question. And I think I do talk about this in my book a little bit, but you're right. I don't think you really hear about this in Chinese medicine much at all, unless you're studying in classical Chinese medicine. But so two things about this idea. First is that, interestingly, in the primary channels, the heart and kidneys do not communicate, right? There's no internal pathway that goes from the heart and the kidneys to each other, right?
I see.
It goes from the kidney into the lung before going in, right? That's how it moved from the lung, and from the lungs we see movement. Or we look at the other place that we do see a heart-kidney connection in the channels is in the sinew meridians. And in the sinew meridians, what happens is you have all the musculature around the chest, what goes up the arm, right? The medial part of the arm into the side, like where there's gallbladder channel, and it comes all across the pectoralis muscle into the center, and then it goes down the midline, this whole muscle band, and it wraps around the umbilicus, right? So that's the kidney connection, right? It goes down into by kidney 16, and it wraps all the way around that channel into the lower abdomen. And the other interesting part about that is when we're looking at the sinew channels, what we're looking at is Wei Qi, right? So we're looking at the movement of Wei Qi, right? Defensive Qi. Now, Wei Qi is responsible for smooth muscle contraction. Wei Qi is governed by the lung and the liver, right? From a Zhang Fu perspective, right? So the lungs and the liver deal with the Wei Qi movement. Of course, all the sinew channels do. So every channel system has a capacity for that. But all of that is said to be under the auspices of the lung and liver, right? So we see Wei Qi as a function of lung, and Wei Qi deals with smooth muscle contraction. The heart is a smooth muscle. So lung Qi, Wei Qi, has a major role in heart rate and rhythm. You follow that? That's a really important concept in understanding heart shock, because of course we see that with things, so you get scared, you hold your breath, right? You lose that capacity. Your diaphragm doesn't expand, right? What allows for the diaphragm to expand, right? Kidneys grasping lung Qi, pulling the diaphragm down is partly part of that mechanism too. So now we see that kidney, lung, heart dynamic, right? We look at the whole Wei Qi movement as another layer that we kind of like put together into that mechanism. And now we have all those components sort of making a lot more sense together, right? And so why, when we get really anxious and our adrenaline's going and our breathing goes and our heart rate goes, right? These mechanisms are all sort of intertwined intimately, right? Cardiopulmonary circulation, of course, is intimately connected, but so is that whole mechanism from the adrenals into the breath, into the heart rate. Not to mention, of course, even, the nervous system, which is going to reflect the nervous system and its reflection of the mind. Dr. Shen talked, a ton about that. I write a lot about that in the book. So all of those dynamics are happening simultaneously. And so they're all always ever present. You can't ignore one without the other. But you're right. I think a lot of people do ignore the lungs in that scenario. And so we have to always consider that. And the other part too is that because the lungs, right? So in its most simple way of understanding that, trauma is something that happens from our past that we are stuck in, that sort of dictates the way we are looking at our future, but we're never in the present moment, right? Because we're hypervigilant, we're always scared, we're always looking ahead, right? The liver and the eyes, tunnel vision, always like looking for threats and perceiving threats around us, right? We're never really just in our breath, in the moment itself, right? And that's part of the lung dynamic that gets shut down. And so, moving someone out of trauma to start needs to move them into the present moment. So lungs are really important.
Oh, wow, interesting. That's a lot. Thank you.
It is it's a lot of like all these pieces that sort of like have to fit together in this like big puzzle, because when you just look at one piece of it, or you try to just treat one piece of it, you can't really get to a full resolution of something, because it's like a seesaw. If you've got multiple things that have to be balanced, and if you're only treating one thing, then you wind up, just creating a problem somewhere else in a symptom. And then you think, oh, well, gee, I'm doing acupuncture and Chinese medicine. I couldn't have caused a problem. Acupuncture is regulating. I can't, you know what I mean? It's like that's like this misconception, if you're not understanding the interrelationships of everything, right? It's like the systems approach. It's not really just looking at like an isolated variable or two.
Now, you may have covered this and I'm absorbing it, but in what sense is the lung shutdown actually shutting down the heart?
In what sense is the lung shutting down the heart?
You described that, because it seems like what happens is people hold their breath to protect the heart.
Well, the first mechanism of heart shock is sort of like, in many respects, it's like a recoiling, right? So imagine if someone like made a really like loud noise, or a gunshot was right behind you. You recoil inwards. Everything compresses and tightens and moves in, and blood and moves all to the periphery. I'm sorry, blood moves all into the central aspects deeper in, right? Because it's want to preserve organ functions, and the periphery gets stuck, right? So the yang kind of disperses outward, yin goes inward, and we create this separation of yin and yang, which is the primary dynamic of heart shock, right? So the heart rate flies really fast, but there's no compensatory mechanism to anchor it back down, right? And so we see the elevated heart rates, and they stay elevated, right? And we see the nervous system and the adrenaline and all the things that create the hypervigilance take place, right? One of those dynamics happens to also be the lungs and the chest, right? Breathing gets rapid, right? So breathing is part of the lungs, and the rapid breathing is going to stimulate the Wei Qi to get the heart rate to go faster too, right? We know if we want to slow the heart rate down, we slow the breath down, right? So that's the compensatory mechanism. So we can control it that way, right? With good control and mindfulness and so forth, right? And time and practice and learning how to re-regulate those things, right? And so that's always part of the nature of things, is showing and teaching someone, first doing it for them, and then showing them and giving them the resources to self-soothe, right? Because the self-soothing mechanisms get impacted. The fire phase gets completely becomes chaotic, right? Pericardium, the heart protector, small intestine, which discharges heart fire, triple burner, which regulates all of these dynamics, right? Thermoregulation, temperature, in terms of even emotional regulation, all these things go haywire. And so we lose this sort of protective capacity, and then everything else just sort of goes on from there. Adrenaline keeps going, and that stimulates the nervous system because it's got to process the adrenaline, and that creates more tension, and that makes the nervous system, the mind relationship, and that stimulates the heart more, and the heart goes faster, and it becomes this crazy vicious cycle that goes on and on and on, and the breathing gets rapid and shallow, and then we don't discharge gases and properly, and so now we're building up toxins internally. You can follow this into go really dive deep into all the chemical and physiological reactions that take place as a result of this too, because blood stagnates as another mechanism for this, right? When you experience trauma, the blood stagnates because it's trying to compartmentalize, emotions circulate and reside in the blood. And so if your memory and emotions and all the things are in the blood and you experience a horrible trauma that you don't want to remember, right? You compartmentalize that, you stagnate it so you don't got to feel it. You numb yourself, right? And so that creates stagnation. Then you got the waste products from blood that's not being properly moving through the system. There's so many dynamics at play, all at the same time. The lung is definitely an important one for sure.
Thank you. That was very interesting.
All right. Anybody else? I know we're about 8:20 something already, so I don't know. I know Cash, you jumped in late. I don't know if you have anything you want to ask or any comments, but here's your chance.
Thank you. I'm happy to be here. I assume you're covering all of this at the retreat in April, yes? In great depth.
Yes.
Yeah. My son had a band concert. I apologize for hopping in an hour late.
Oh, no, that's okay. No
So
worries.
fascinating to hear you talk.
Yeah,
And-
thank you. I'll make the recording available. So I know a lot of people like shot me their emails, and I knew that a lot of people can't make it live, and that's okay. But yeah, hopefully you can make. I know you got a conflict for April anyway, right?
Me?
Yeah.
I did, but it's cleared. But I'm gonna message you. I
okay.
think I want to come. I just have to figure out the flights and travel situation.
Yeah.
I might have to leave early is the only thing I'm really trying to figure out. But I'll message you privately.
Okay. Yeah, totally.
Yeah.
That's great. Yeah. All right. Jen, I know you're got a lot going on there in the background, but if you have any last questions, or anyone else, Sarah or Elizabeth? No? Okay. Well, thanks for joining me on a Tuesday evening.
Thank you. Thank
It was
you.
perfect because my wife took off for a couple of days to Atlanta, so I'm just hanging out. So it's good. It's good to spend it with friends. So that was nice.
Thank you, Ross.
Thank you very much. Bye-bye.
All right. Bye, guys. Take care.